A case of appendicitis almost always led to an operation, but that's not always the case these days. Some doctors are suggesting it's okay to take a watchful approach. Here's the latest in this week's Positively Healthy.
Appendicitis is one of the most common ailments that we see through the emergency room as a general surgeon. It affects about 7% of the population.
While appendectomy is a very common surgery, growing evidence suggests there are other effective treatments for appendicitis.
If you come in with just mild abdominal pain and workup in the emergency department reveals early appendicitis, we can try treating with IV antibiotics, and if you have drastic improvement initially, then we can try conservative management without surgery.
Research finds antibiotics were effective in about 6 out of 10 uncomplicated cases. Antibiotics may also be used to slow progression in acute cases as well.
But we do see that once we start antibiotics, it halts that progression, so we don't need to rush you into the operating room in the middle of the night. We can wait till the following day.
The do not operate approach preserves the appendix, which is largely viewed as something we can live without. Now, doctors suggest keeping the appendix may have benefits.
People always say, oh, it does not have a function, but it secretes immunoglobulin A, which helps with immune function to fight bacteria and certain diseases in the colon. So we do see that individuals who have had their appendix removed are slightly more susceptible to certain diseases or infections of the colon.
The theory is that the appendix is a storehouse for good bacteria that may boost the immune system following gastro issues. Still, surgery is most common and eliminates the problem for good, something antibiotics can't do.
The downside with that is that 14% of people do develop recurrent appendicitis within a year. And those individuals do have increased complications such as perforation of the appendix.
Seeking medical help is crucial for either option, but don't be surprised if antibiotics are the first line of treatment.